My name is Margaux Stack-Babich. Welcome everybody to round 2 of vaccination communication, inoculating against misinformation. For those of you who may have joined us in December, this is a dedicated Q&A format. You may have seen us present. It was a panel and presentation combination previously. Today, we had so many great questions that didn't get answered in our first series that we really wanted to dedicate time in just a Q&A format to get into this very critical topic that affects not only COVID, but all routine immunization in the US and also around the world. So thank you for being with us today. We are just about to formally begin. So just to reiterate, today is a Q&A session. We have your questions that you submitted previously, but we also welcome you to submit questions, and we'll show you how to do that in just a moment. And just to make sure that everyone's familiar with the hosting organizations today, the California Immunization Coalition, which is the primary host of this conversation, is a 501c3. It's a nonprofit that's dedicated on a public-private partnership in achieving and maintaining immunization protection for Californians and promoting health and preventing serious illness, disability, and death. So many of you, I'm sure, found this webinar through the outreach of California Immunization Coalition, and we're so glad that you did. Our co-hosting organization, and that's the organization that I am working with, is the San Diego PATH Work Group, which is administered out of the Morris Cancer Center at UC San Diego Health. And the goal of this work group is to reduce the incidence of HPV-related cancers in San Diego County and the surrounding areas by increasing HPV vaccination to 80% by 2026. And we do this through clinical intervention, education and training, and advocacy and public policy engagement. And we are so honored and pleased to work routinely with the California Immunization Coalition on achieving this mission. So we are grateful to be your partner. And I know everybody's probably a Zoom vet at this point, but just to reiterate in case you're having any issues today, this is a webinar. It's a listen-only mode, so you should be able to hear through your speakers. If you do have any technical difficulties, you can identify some strategies on Zoom support, and you can also dial in. So just check out those opportunities. And if you're having issues, you can message us throughout. And if you have questions today, we really encourage you to use the Q&A format. You'll see that in the toolbar at the bottom of your screen, and we love to see your questions. And many of them, may be represented in some way in the conversation as we get going, but, please do submit the questions and we'll do our best to address everything you raise. So as I said, my name is Margaux Stack-Babich. I'm the Community Outreach and Engagement Coordinator at Morris Cancer Center at UC San Diego Health. And I'm very honored to help moderate today's conversation with my colleague, Dr. Eric Ball. Dr. Eric Ball works at the Southern Orange County Pediatric Associates and the CHOC Children's Primary Care Network. He's also the District Vice Chair of the American Academy of Pediatrics, and he's the past president of the American Academy of Pediatrics in Orange County. Dr. Ball has worked on many of these important conversations on this really critical topic. Again, it's a topic that we know folks are hungry for information and insights on how to address this, how to better strategize and incorporate techniques into their practice. So we're so fortunate that Dr. Ball is leading this conversation with our panelists. So our speakers and panelists today are Dr. Alex McDonald. He's a family physician, sports medicine specialist at Southern California Kaiser Permanente Medical Group. He's a co-founder of This Is Our Shot campaign. He is joined by our other wonderful speaker and panelist today, Dr. Todd Wolynn, who's a pediatrician, the CEO and co-owner of Kids Plus Pediatrics in Pittsburgh, and he's the co-founder of Shots Heard Around the World. So we're going to give both of these wonderful folks a chance to tell you more about their respective organizations, their experience, their passion for this topic. And before we do that, I just want to acquaint everybody with the immunization landscape since we last spoke. So many of you joined us in December. A couple of new studies have come out that really, again, just put a fine point on how urgent this dialogue is today. You can see here on the top right, and many of you may have seen this study, this was widely covered in broadcast news. The CDC issued a new study showing that for the second year in a row, kindergarten immunization rates dropped another percent point. They had dropped between 2020 and 2021. They dropped again in 2021-2022 year, down from 94% to 93%. 1% may not sound like much, but as you can see from the infographic, that means 250,000 kindergartners are potentially not protected against measles. And many of you may have followed the news story in Ohio through December about the outbreak of measles, which was almost exclusively spread through unvaccinated kids. The companion headline below that is probably where we're getting our perfect segue into today's conversation. More than a third of parents oppose vaccine requirement in schools, according to a Kaiser Family Foundation study. What's important to note there is that in 2019, 23% of parents expressed opposition. In 2022, 35% of parents expressed opposition to vaccines and for school requirements. That increase is really important for us to pick apart, and it's something that we will get into today. On the left here, it said COVID isn't the only reason that kids' vaccination rates are falling. That article gets into some of the policy work, quality improvement work. Many of you are very familiar with that. We don't have as many well-articulated strategies that are widespread and available to look at dealing with vaccine misinformation and disinformation. So again, we are so fortunate to loop back to Dr. Wolynn and Dr. McDonald on those strategies because they are an area of dire need. And so just to set this up, that we also are approaching preteen vaccine week in California. We are looking at an immunization deficit across the board for adolescent immunization. We have not recovered in California from the drops that we saw in the early pandemic. And so again, today's conversation is really critical for setting us up to really put energy into our vaccine promotion efforts and consider the important topic of vaccine mis and disinformation. So with all that said, I want to give the mic over to Dr. McDonald to introduce himself and his organization.
Thanks so much. I'm really depressed looking at that data, but that's okay. That's why we're here. We're all collectively gonna fix this problem. So thanks so much for coming back. I guess we didn't bore you enough the first time. So if you didn't see the webinar from December, go back and watch it. And this Q&A will probably make a lot more sense. I'm Alex McDonald. I do family medicine and sports medicine, as Margaux said. I have self-professed SMUD, social media use disorder, and so I do a lot of Twitter. I've started doing more Instagram recently due to various new owners of Twitter, but that we won't go there. And I'm really passionate about spreading our message as trusted healthcare messengers outside the four walls of your exam room, your hospital, what have you. Back in the late winter of 2020, right before the COVID vaccines came out, a couple of friends and I got together and sort of developed this group, which we called ourselves. We ultimately decided to name ourselves. This is our CHOC coalition and also our sister Spanish campaign, Vaccination, to really help elevate the voice of healthcare heroes. It's not about one person on the TV screen telling you to get vaccinated. It's about your individual physician having those conversations, boots on the ground, doing the work. We've done a lot of work partnering with community organizations as well too, to really help address people's questions and really help people get good and trustworthy information so that they can make the best choice for themselves as well too. So I could go on, but I'll stop there. And Todd's far more charismatic and better looking than I am too. So I want to hear what he has to say.
You guys are so sweet. I'm thrilled to be here. I'm Dr. Todd Wolynn. I am the co-founder of Kids Plus Pediatrics and the co-founder of Shots Heard around the world. So our practice in Pittsburgh, Pennsylvania in 2017, pre-pandemic, made an HPV PSA 90 seconds. It was spectacular. And it was having all great intended effects, 15,000 views, people calling up to schedule their kid for HPV visits, which was great to get the vaccine. And then a mom in our practice loved it so much, she posted it to her Facebook page, and her sister-in-law was an anti-vaxxer and dropped it into a 40,000 strong Sherry Tenpenny anti-vax group. And what ensued was this global coordinated anti-vaccine attack. pretty much one of the largest scale attacks. Wendy Sue Swanson had been attacked about a few months before for a flu post, but we decided to not take the post down and to research it and to respond. So we did we went over to the Graduate School of Public Health at the University of Pittsburgh, did a research project on it, published in the journal Vaccine, created an anti-vax toolkit, took a page. By the way, all the people that attacked us, just to be clear, this is true of almost all attacks, are not your patients. We were getting attacked from Ireland and Australia and New Zealand, and for sure Texas and Ohio and Florida, but nobody was our patient. And that's what they do. This is a very well organized, now well-funded, pretty sophisticated network that tries to control message. And so they first thrive on using the platforms, which is sensational content, and it gets amplified on its own when it's not factual. And now the other thing is attacking vaccination advocates. So where we came, just like Alex's project, ours came in 2017 after our attack. We're like, hell no. And so we basically did all this work and launched a nonprofit in March of 2020, which was a bad time to launch anything, and then realized by the end of that year, we couldn't continue to do this on our own, and handed it off to this amazing organization called Public Good Projects, which now has the largest pro-vaccination advocacy portfolio, which includes shots heard around the world. This is our shot, the Spanish version of Vacunatea. They also have the Vaccine Communication Tracking Response Network, which the CDC uses exclusively for social listening, and Stronger.org was also part of it. So I'm thrilled to be here, and thank you.
Thank you guys so much for joining us again. This is all meant to be interactive, so we're going to try to have a conversation. If anyone on the call has questions that they want to ask Dr. McDonald or Dr. Wolynn, please put them in the Q&A box. I wanted to start by kind of giving a little bit of an anecdote about what we encountered with our practice when we were trying to vaccinate our own providers. So we actually found a lot of hesitancy just within our own staff, within our own front office, within our own nurses. And I see that all the time now. Everyone knows of stories of people who got fired from their job because they didn't get vaccinated. And I think at the last talk, spent a lot of time talking about vaccine confidence in our patients and the general population, but I think we have an issue from within. And this is not something we learn about in medical school or nursing school, how to differentiate misinformation from real information and how to navigate these waters, because we're all on social media too. So I'm wondering if you have any tips of how we can best learn to identify what's real and what's not real, and then how we can talk to our own colleagues to convince them to vaccinate or to become more health literate.
Happy to jump in first here. I want to start with one big premise, right? Why are you guys all on this call? Why are we talking about this? Because a lot of the questions that we've seen are about, what can we do? And there's politics and there's money, and there is irrefutable data showing that the most trusted, most impactful person on health decisions is a family's trusted local healthcare provider. That can be a doctor, a physician assistant, a nurse practitioner, a public health professional, somebody who that family recognizes, and it might be somebody in your community. It could be a school nurse. Any of those are okay. But the key is we don't leverage that trust in a powerful way. As a matter of fact, none of us, I believe, I can say this accurately, were trained, at least those that went through medical school, were trained in communication. Public health at least has communication courses. We weren't. And so what we do is we live in this fallacy that we have to wait till they come inside the four walls of our exam room, and now I'm going to impart all my wisdom upon you. That's not how we got to where we are today. The way we got here is really powerful communication strategies being leveraged on the most powerful communication platform ever known by humankind, which is social media, which is why you keep all hearing us reference it. And yet you're not trained to use it. You don't know how to use it. And furthermore, face-to-face, just like Eric was saying too, even our own people in our own offices, including our own staff, we aren't trained particularly good in how to communicate face-to-face, particularly when faced with questioning. And I'm starting to substitute in questioning and for hesitant, because hesitant is charged because, right, you're saying they're hesitant. That's a negative connotation that they don't like healthcare. That's not the case. They just have questions. So I'm just letting you know, I'm now slowly shifting toward questioning. But to get to that whole point, we need to be better at communication. And I'm hoping we can give you some tips. And I probably went on that rant just to hopefully lay down a platform that we're capable of doing this. And each of us as a healthcare provider serves in primary care 1,500 to 2,000 people. And we squander that every day and let them go here while they're on the toilet at 10 or while they're breastfeeding at 1 a.m. And we aren't here to meet their needs. So I'm going to stop for my rant and let Alex bring us back into my blood pressure down, and then
I can keep ranting if you want me to. I mean, I to your point, you know, the average patient sees their primary care doctor for 15 minutes 4 times a year versus they're spending 2 hours a day on this thing, right? So how can we possibly compete with that if we're not there? We need to be where people are. So I think to bring us back to the question here, you know, it's really, COVID provided us this very unique opportunity where as physicians and healthcare workers, we got to lead. We got to lead by example. We were the first ones. I remember this moment will be etched in my brain forever. I was rounding in the ICU December 17th, 2020, wearing an N95 and a whole bunch of garb, and I get a page saying COVID vaccines are now available for healthcare workers. And I literally dropped what I was doing. Don't worry, no one was actually actively dying at that moment. And I went and got vaccinated. I will remember that moment etched in my brain forever. And then the biggest side effect of getting the COVID vaccine was the inability to stop talking about the fact you just got your COVID vaccine. And I literally told every single person I knew, came across, I posted on social media. It was by far my most viral post I've ever had. I'm not really an influencer. I'm a nobody, but hundreds of thousands of likes and reshares. So I think by leading by example, both in the exam room, in the office, and then also on social media, we can really build trust. The number one thing that gets patients, particularly for, you know, any vaccine, but particularly the flu shot or the COVID vaccine recently, is I tell people I got vaccinated and I physically vaccinated my own children. That is the most powerful. If someone's sort of on the fence and they're not sure, when I tell them that piece of information, they're like, "Oh, you vaccinated your kids? Well, I guess if it's good enough for you, you know, I should probably consider it as well too." I think leading by example and sharing that information is just so critical, regardless of anything we talk about. I always tell patients I would never recommend a treatment or surgery or pill or vaccine that I wouldn't take myself or recommend to my own family members as well too. Okay, I'll stop my tirade there and keep going.
I do see a question. Can I take a shot at the first question I see? So it asks about, is pointing out that a lot of anti-vax sources are using outrage to make money, been helpful to persuade those on the fence. It's a strategy, right? We need tools in our toolkit. So the first one that I would say that Alex just shared is leading by example. Absolutely, right? You need authenticity, particularly for Gen Y and Gen Z, and they don't want to hear what you think they should do. They want to know if you did it as well. But again, think about any politically charged thing, because this is clearly now become a politically charged thing, is the words that are used, right? Are you pro-life? Or are you pro-choice, right? I mean, people put words around to emotionally charge up something. So I see other questions on here about the physicians for informed consent, like we're not giving informed consent, or truthfulness or truthers or whatever, right? So this first one's asking about calling out the sources that are using money and outrage. Absolutely. And you can do that with an incredibly powerful tool that they use all the time that we never use. It's called narrative. Instead of saying, today, I will recommend that blah, 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 you tell a story. Did you know that there are 3 reasons why disinformation is pushed? It's usually, I call it the 3 Ps. It's for profit, for politics, or for power, right? People either are going to make money, don't get vaccinated, but use my oils instead. Or politics, I'm going to keep government out of your business, vote for me. Or power, right? They say something crazy sensational. And like Alex said, watch what happens when you put disinformation out there and you watch how it blows up. So you can either go power through a viral message, or don't forget, and we have great data on this, that there are tons of trolls and bots that are programmed or pushed or paid for by hostile foreign countries that target democracies where freedom of speech is around. And so they love like putting out stuff that's going to cause chaos. And the interesting thing the data shows, and this came out of I remember an NPR piece on the active measures playbook from like the old Soviet Union, which is they stir chaos by actually taking out accounts on both sides. So for BLM, they'll have pro-BLM and anti, or Second Amendment and anti-Second, right? And they'll try and just sow some stuff that's kind of crazy. And the thing that happens is there's this notion of tribalism. I don't know you, but you're in my crochet or running Facebook group. So if you say it, you're kind of like me, but boy, that's a little off the wall, but okay, I'll go with that. And they just sow this stuff. So back to the original question. Yes, I do use that 3 Ps, and I talk about in a narrative fashion. I take an oath to do no harm. They don't take that oath. And lots of people have been steered down the wrong path and have been harmed or died. And guess what? They're not liable and they don't care.
Well, now I'm depressed.
Nah, I should have taken some Ritalin. I'm like feeling like my ADD is out of control today.
I'm easily impressionable, so I'll just try to match your energy level, and we'll just go off the rails really quickly.
We are loving it. I'm hoping we can kind of dive a little deeper too into the actual mechanics of the vaccine conversation. And I come from being pretty single-minded on HPV vaccination, and sometimes there's specific messages and arguments that are seen to be even more powerful in that particular vaccination promotion and conversation between the doctor and the patient. We've looked at motivational interviewing, training techniques in the context of vaccination promotion. And I guess the question I'm kind of driving to, or sort of funneling us into, is in your talking about the tools in the toolkit, the different strategies, are there other recommendations or strategies that you can share with our audience about the best kind of approach? Maybe it's sort of maybe a step back from some of the messages, but like the framing and the setting and what is really the optimal environment to have a conversation with someone who is hesitant or questioning.
So I'm going to put my primary care hat on. I think it all depends on the patient, because there's not a one size fits all approach, and really knowing the patient and ideally being their primary care doctor and having a longitudinal relationship where you've taken care of them and their family members for years and perhaps some situations decades, that historical trust in that relationship and that patient physician relationship is the most important thing. So knowing the patient, knowing what motivates them, maybe what doesn't motivate them, is my most go-to tool, I think, when it comes to having these conversations, because there isn't a one size fits all approach, which makes it so hard. Even though we all want to spread our messaging on social media, I think those individual conversations are much more powerful. But it just takes time. It takes a lot of people doing it at the same over and over again. And time is the one thing we don't have a lot of times as physicians and other healthcare workers as well too. So for me, it's always just about the individual and seeing what motivates them, and oftentimes asking them, like, why don't you want to get vaccinated? And then really listening to that answer and approaching it with empathy. Gosh, if I was worried I was going to be sterile after getting the HPV vaccine, I'd be worried about that too. That makes a lot of sense. I can see why that's concerning. And then you dovetail into providing maybe better information or more accurate information. But it's not just about the information. We're not driven by data. We're driven by stories and relationships as well too. So I wish I could give you a one answer, but I just can't, because you have to tailor it to the individual.
Yeah, I'll further jump in and just support everything that you just heard from Alex. But I will say, and I've taught this and have been involved with researchers that have worked on this as well. The two things that healthcare professionals tend to do when they're faced with questioning, or some people might say hesitancy, is this very natural thing. And there's good data showing that we do this. We'll say one of two things, which is scare you. Let me show you some scary picture or tell you about the number of people that are harmed or die that don't do what I'm telling you should do. Or two, data. Let me tell you, the study showed 95% confidence intervals. This was 67.34. And you're over here, right? When in fact, what Alex just told you was show some listening. And we have a great question here. Are we asking parents the right questions in order to improve communication? Are we listening carefully, right? Asking the right questions? Absolutely. And you heard him giving you, exactly the pieces that I talk about. Now, I'm going to I probably said this before at the last one. I'll reiterate it because it is kind of formulaic. It's not motivational interviewing, but it has a fun mnemonic that makes it easy for me to remember. And honestly, we haven't been trained on dealing with questioning. So the one I've worked with is AIMS, announce, inquire, mirror, and secure. So very quickly, just like you heard you might hear a parent say, well, I don't know that I want that vaccine. So you ask, can you tell me why? What's concerning? I've known you, Mrs. Jones, forever. Timmy's been my patient here for 7 years. Can you tell me? Well, I heard that vaccine. My brother-in-law last night just said, we were at dinner, and he said that vaccine is genetic. It'll change his genes. And you say, so let me make sure I got this right. Your brother-in-law told you that the vaccine, let's say COVID vaccine, can change his genetics. Yeah, that's what I heard. Okay, so you've announced, you'll say, I think Timmy should get this vaccine. Then they say no. So now you inquire, tell me what's going on. Now you mirror their exact words back. So you said this, your brother-in-law said it could modify his genes. And now it gives you a chance to, again, express empathy, just like Alex said. So you can say, you know what, that would scare the heck out of me if I thought that was the case. Now you've taken time, you've displayed active listening. They now feel felt. That's in terms of communication research. And now is an opportunity to also express some empathy, just like he said, which is, that would scare the heck out of me. And now you can follow up and say, can I tell you why I got my kids vaccinated? It changes the dynamic. It sounds subtle and it sounds easy or simple. It's really not, because we interrupt and then we go right to fear and data most of the time. And we don't use listening, and that mirroring actually displays listening. And it's one of the best practices, again, is repeating, like, do I have this right? Do I have this right?
Yeah, and if I might add one more thing, that there's been more and more evidence showing that if I like that Ames analogy, and you do that, and towards the end of it, you actually ask permission. I hear you're worried about the vaccine changing your genetics. That sounds really scary. Can I tell you my thoughts? And 99% of the time they're going to say yes. And then it just totally changes the dynamic in terms of how you approach that conversation. It becomes much less adversarial and much more collaborative when you ask permission to give your insights. Todd's going to give me some other thoughts here too.
No, I forgot to give you the S. The S is secure, where at the end they say, I don't want this for Timmy today. You have a trusted relationship. You're not blowing it up over this. You're not leaving in a huff. You say, you know what, I really appreciate the chance to talk about this. And obviously, I know that you don't want it. And I'm still going to hopefully have a chance to talk to you in the future about it, but I appreciate the opportunity to talk. We can revisit again, right? Secure the relationship. It's the trusted relationship. The longitudinal primary care trusted relationship is super powerful.
I think we want to at some point shift to talk about just vaccines in general and not just COVID vaccines. But I have one last thing that I want to talk about COVID vaccines in particular. We're 3 years into this pandemic, over 2 years into vaccinating people. If you haven't been vaccinated by this point, either you're probably really against it, there's a reason you haven't been vaccinated, or you've had COVID like 4 times by now and you think you're immune to it. So in all honesty, are you even trying anymore with those people, and why or why not?
I mean, here's a great place where you can start with data, which is, there's this thing called survivor bias, right? They've had it 4 times. They're still playing kickball. They're doing great. And, I think obviously working on the trusted relationship and making sure you're allowed to offer this or feel in a comfortable place to offer it, saying, I know a lot of people think natural immunity, which they view as getting infected, is natural. And that's the best kind of immunity. And we actually know, particularly with this virus, if we're back on COVID, that's just not the case, which is why you can see that you get it and you get it again and yet again. And we also know that there's a lot of risk with sequential and repeated infections. It's never too late to get it, the vaccination, which is also a natural form of immunity. It's just you're presenting something in a much safer way. Your body still makes its own immune response, and it sets you up for way better outcomes. And we have good data showing that, which if you're to the point where you can talk data, you can talk it, because it's not scary data.
I mean, I think we owe it to our patients to always educate them every single time. You never know. I'm going to change the example and use diabetes, right? I have tons of patients with diabetes. Their A1C is 14, and every single time, hey, I'm really worried about your blood sugar. How can I help? Hey, I'm really about your blood sugar. I recommend you take your medications. And sometimes it's taken years, but eventually patients were like, you know what? Okay, and then they get their A1C under good control. And it could be about anything. We have an obligation to continue to provide good, accurate information, because ultimately my job is to take care of my patients and to keep them healthy. And whether that's vaccinations, whether that's medications, whether that's diet, exercise, you name it, we have an obligation to continue to share that message. And if we don't say anything, we are complicit in reconfirming their biases. Oh, I went to the doctor 4 times and no one told me to get COVID vaccine. How come you're telling me now? And so even it can be as quick as getting up to leave. Hey, by the way, I see you haven't had your HPV vaccine. Hey, I see you haven't had your COVID vaccine. I would recommend it. You can get it today before you go. And usually they say no, but you're like, okay, well, if you change your mind, we'll be here for you. It can be literally 20 seconds. It doesn't have to take a lot of time, but if you say consistently every single time I respond to a patient email, I get tons of emails a day. At the bottom, I have a list of oftentimes you do for your PAP, you do for your mammogram, you do for your HPV, you do for your COVID vaccine. I list it at the bottom of every single email I send because eventually one day it's going to stick.
On that note of passionate persistence to serve your patients as best you can and to really deploy the full suite, as you raised earlier, of all the tools in the toolkit, all of the discussion points, strategies, talking points, all the things, that you constantly have to avail yourself of. This might be a perfect moment. If you would indulge us, could you talk a little bit more about your respective organizations and how you founded them? And I know, Todd, you talked a little bit more about yours in the beginning, or sort of that inciting incident, but could you talk a little bit more about how you felt so compelled to start, develop an organization in the outside of your practice?
Yeah, I'd be thrilled. So when we were attacked, if you've never been on the end of an attack, it's a pretty terrible experience and it feels pretty violating and scary. The whole intention of the people attacking you are to basically get you to take your post down, right? That's why you're being attacked. So I often say it's our communications director said it's a badge of honor. I say it's a badge of success, because if you only have 1 like and 1 share, nobody's coming to bother you anyway. But as soon as your message resonates, they view you as a threat. And in some ways that's fulfilling. I hate to say it. If you've been on social media long enough, if you're getting some attacks, it actually isn't bad for business as far as getting viral. That's the way the algorithms work. But what we realized was it was pretty terrible, and where there was nowhere to go for help. There was no playbook, which is why we created a toolkit. We now regularly get people reaching out to us, telling us, or people reporting attacks to us. And it's also nice to know, like, you're not in this alone. There's other people that have been through this. You can get through this with some guidance. I will tell you, and I'm not trying to scare people out there, but where they really have moved to is not just swarming you and making you feel isolated and scared and violated by these very mean things. They now try and report vaccine advocates. I mean, you need to know that, to their employer or to their licensing board. So at Shots Heard, we actually now write letters. We have pre-made letters letting hospitals or health systems or other employers, as well as licensing boards, that this is a tactic used by the anti-vaccine industry, which is an industry now. And this is a fraudulent way that they try and create harm to individuals. The other thing is they try and create harm to practices or even health systems by going after the rating systems on Google or Yelp or wherever else they can. Sadly, that will oftentimes motivate CEOs and CFOs in the C-suite to start changing direction, say, hey, let's not talk about vaccines, which is the absolute worst thing you can do. And it's exactly what they're trying to get to be done. So we receive tax dollars, we receive education dollars. We are literally, and I am very provocative when I give these talks, but I say, if you do so, you are knowingly abandoning your patients to the other nefarious forces out there that are trying to engage them and steer them again for profits, politics, or power. And yet we're going to abandon them. I'm going to be very clear on today's Q&A. Our health curriculum and our health strategy needs to change. And every time I get onto any of these, I'm going to be speaking at NYU. I just spoke at Texas Tech. We need to change our curriculum to teach us about communication and how to leverage the most powerful tool, because at the end of the day, regardless of your public health, your nursing, your pharmacy, your job is behavior change. Your job is behavior change. To get a pap smear, to eat a plant-based diet, to exercise more. We're all in the same thing, right? 40% of health outcomes is behaviorally driven. So our job is behavior change. And I'm going to just say one more thing and then I'll hand it off, is Every other goddamn business sector out there uses this to change behavior. You buy your $10 double pump mocha latte because you get nudges on here. And before you know it, you're like, I got to have another caramel macchiato, whatever. And you're buying it because you've been nudged, or you book a cruise, or you buy a certain car because every one of these companies knows positive return on investment. I can make you do things. And yet we can't wrap our heads around, boy, I wonder if I could get people to get pap smears or stay on their asthma regimen if we use this more effectively. All right, I'm done. I'm calming down again.
I literally have nothing else to add. That was perfection. No, I completely agree. And this is our shot in Vicuna Teya. We're kind of actually at the other end of the spectrum, really, to help educate and empower physicians to really be online, to raise their voice. Essentially, again, it's not about me. It's not about Dr. Wolynn. It's not about any one physician. It's about collectively all of us doing it together. So that if we have 1 million physicians and I think we have about 50 million nurses, some crazy number. If we all are active online, are spreading good, accurate information, we're going to be able to have an impact too. And that's what This Is Our Shot is all about. It's about giving physicians and nurses and pharmacists and healthcare workers the tools so that they can then feel comfortable. And then when they make it right and they get attacked, because that's the goal ultimately, that's when Shots Heard sort of helps and provides some damage control as well too, which is why these two organizations kind of were acquired by Public Good Project, and it works so collaboratively as well too. I just think I want to add one other piece to that also, just regarding the social media use, is that for so long physicians have been discouraged from speaking up. They're getting their hand slapped from their employers sometimes for maybe being a little bit too truthful or a little bit too honest, and that needs to change. And we need to have physician-led teams and cultures that are supporting our physicians so that we can speak up, we can provide accurate information, and all this BS about providing medical advice and opening yourself up to litigation is just complete malarkey. So don't listen to it if that's what you're worried about. Okay, I'll stop talking now.
No, that was spot on. I mean, I riff right off of that. Gen Y and Gen Z are about authenticity. If you have a 15-hour wait in the waiting room, talk about your 15-hour wait in the waiting room instead of like, we're fine here. I mean, let them know what you can do to avoid that. But I will say the messaging, again, you heard me say in the beginning, the power is at the level of the trusted local provider, or at least practice. Kaiser's a very well-respected integrated delivery system, but a message coming from Kaiser does not have the same value, nor Mayo Clinic, nor Cleveland Clinic, nor UPMC does not have the power of, hey, that's Sally, my doc, or Joe, my nurse practitioner, or whatever, or at least at the practice level, something that they have identity and connection to. And that's why, back to exactly what Alex said, which is, we need to change not only the training from the school level, but all the way through where we get to the practice to leverage this trust. I can't say it enough. We squander this every day while every other business sector and nefarious actor has figured out, all I need to do is form a bit of a personal relationship and keep a dynamic dialogue going on, and I can pretty much get you to do anything. I mean, it's true. And we take an oath to do no harm and use evidence-based decisions to try and optimize your health. And these people are selling you insurance, cars, and crystals.
So I want to build on that, Todd. You had mentioned, dealing with the CEOs and the C-suite, and Alex did too. And I totally agree that we are the most trusted messengers. But I have a very limited reach on social media, right? I mean, I have a few 100,000 follower or 1,000 followers. No, you guys are bigger reach, but still quite small compared to Kaiser. Kaiser tweets out something, millions of people will see it right away. And I'm sure you guys are the same, but I've had my hand slapped by my various organizations for saying things. And I find that most of these organizations that have these big reaches tend to be extremely conservative in their social media messaging. They'll talk about what to do with a fever, but they won't go near anything that is deemed controversial. And sadly, vaccines are now in the realm of controversial, which is crazy. So what have you done, or what do you recommend that we do to the people who run these social media accounts or higher ups and get them to be more out there about pushing this message?
Well, I'll start by saying they aren't particularly in touch, right? The C-suite's usually people with the pinnacle of their career, which usually comes with age, and not particularly a lot of familiarity with social media. The other thing is that they're pretty conflict averse when they see, or risk averse when they see this can happen. But again, You aren't, if our goal is to get better health outcomes, then we need to have authentic conversations. And what you're seeing at its max in those large organizations, I'm not saying that they aren't have some value to get a positive message out, but you're seeing corporate communication, which is very safe and very generic and very unappealing, right? Like, think about it. A message comes out on car seats. The following message is on gallbladder surgery. The following message is about a memory unit. Who the hell is the audience? The first role of communication is know your audience and make it interesting and engaging, right? Which is why your practice, again, should be empowered, not slapped, for trying to effectively engage your members or your clients or your families.
I think, particularly for some of these larger organizations, they are very risk averse. They do have a lot to lose. And if they see, one crazy physician doing all this wild stuff, they're going to get very nervous as well, particularly if that physician is somehow associated with their organization. So the number one thing that I recommend is you just build a relationship with the people in your comms department or the people in the C-suite, if you can get to them, and just reach out and build some trust, build some relationship between those, and that way they'll see you as a partner. They may think you're a little off the rails and they want to corral you a little bit, but if you a little bit of that relationship and some goodwill and help partnering with some of their projects as well too, can really go a long way to building your credibility. And then you can give them a little nudge when necessary, and it's going to take time and persistence, but that relationship with your organization, that relationship with your comms department, that relationship with your C-suite is really critical for someone who feels like a frontline worker bee, but has a passion to really change the message. And that would be my number one recommendation. It's not easy. It doesn't happen overnight. It takes time, unfortunately. Again, the one resource we don't have, right?
I will segue off of that, by the way, and back to even Eric's comment. You don't need tens of thousands or hundreds of thousands of followers. You just need to reach your own patients, right? I mean, the fact that we've been doing this and we sometimes will get messages that get amplified elsewhere, your primary goal is to reach your families, right? And you already have trust and credibility, and you're known in your community. You're known from a food drive or a place of worship or a school or a camp. I mean, that's the beauty. You really only need to reach your community. But yeah, it can be hard. I know we have other questions on here about big pharma and other stuff. I don't know if you want us to start delving into any of those, but I want to be mindful of this.
When this could be a pivot away from the C-suite, but maybe back to more of a peer set and across the healthcare professional spectrum. And we touched on this at the outset. But there are several questions that touch on this and several questions we received previously that touch on this. But could you both share the impact of medical professionals who share disinformation and misinformation? I think the trust has been the theme across the board here. So how can you kind of characterize the impact of trust mislaid or misused?
That's a really challenging question. And I think you can have 100 trusted messengers saying one thing, and you can have one nurse, physician say the opposite thing, and they're going to latch onto that because that reaffirms their worldview. So I think our biggest challenge, I don't want to say our biggest enemies, our biggest adversaries, when it comes to building this trust and getting people good, accurate information with which to base their health decisions, are other physicians, other nurses, other PAs and NPs who are spreading misinformation. How we combat that is really challenging. Here in California, actually, we just passed AB 2098, actually, which is the COVID medical misinformation law in California now, which just really reinforces and it stipulates that the Medical Board of California can hold somebody accountable for spreading false and misleading information. Now, it's actually limited to the exam room. It doesn't include social media. So that's a potential problem. But at the same time, that if somebody practices medicine which is not evidence-based or meets a certain standard or threshold, that physician or nurse practitioner or nurse or whoever you can lose their license. And I think we need to continue to push our medical boards to help hold people accountable as well. Now, where's the line between misinformation versus disinformation versus sort of like cutting it, right? Because before something becomes, the standard of care, it's sort of this crazy, weird, outlandish idea. Who knew that leeches were a bad idea at the time, right? Of course, now they're coming back into vogue, but that's another issue. So the issue is medicine and science is constantly evolving and changing, and what was true yesterday is not necessarily true tomorrow. And that's, again, they capitalize on this, like, whoa, well, that's my opinion, and that's not. You're not entitled to you're entitled to opinions, but facts, you're not entitled to picking and choosing your facts as well too. And I think that's what becomes more challenging too. I don't have a good answer for this. So I have a friend who is a physician who, for lack of a better term, has sort of gone off the deep end when it comes to a lot of this information, and he's constantly sending these articles and things, and we stay in communication, and I keep that relationship alive because I think it's really important to one, kind of hear what he's learning about, what his perspective is, and so that I can kind of continue to sort of be like, well, that's not accurate, or that study was an N of 3, that study's like from 10 years ago, and so you continue to have those relationships and continue to push, and you don't have to believe them, but I think have them heard, it can be really valuable as well too. I don't have a good answer though. I don't. Hopefully Todd has something better.
No, those are all the points. I mean, at least in California, you're leading by example. I know right as Richard Pan was winding down, you got that piece of legislation through to hold providers accountable. The sad thing is, right, you see legislation in other states, particularly red states, that are not only not providing that protection, they're actually holding the licensing boards in check so that they can't even oversee their own licensees. So there is something to be said for holding our own accountable, right? How many times do you hear about the big blue wall and police officers don't go out, other bad police officers or people that are abusing the code of ethics or whatever? Do we? I will tell you, on social media, there are some really prominent figures now that have made a point to call out their own, whether they're pharmacists or nurses or docs. That's not without risks either, because they set themselves up for attacks as well by doing that. But I got to say, some people will be like, oh man, I can't believe they did that. I'm like, well, who are you going to do it? Right. I mean, like, it's pretty important that somebody's doing it. So I mean, I reported a doc. I certainly think that we need to hold our own accountable, or what's our license mean, right? We take a code of ethics and we take a pledges and oaths. And I mean, people are being misled. I will say it is important to, as best you can, where you can, keep open lines of communication and listening, but that doesn't include, in my mind, social media when you're being attacked. A lot of, I do want to point out to a lot of people out there, as you've already heard me say, I think it's no longer optional if your practice has some social media presence. I think by not having that, you actually are abandoning your patients. I don't think you have to be on every platform. I don't think you have to have a dedicated communication director. We get into the details at some point, but I think you need to have a presence, but you don't have to be attacked. And it feels good sometimes just to block and ban, and I just weed through my pages now, because nobody said you need to be a punching bag, and you shouldn't be. So
go ahead, Alex. Sorry.
No, I just want to say that actually segues nicely into, I think it's rule number 7 of social media is ignore the trolls. Block, delete, move on, do not engage. It's not worth it. It only bumps them up the algorithm as well too. I think one of the questions was about, if somebody posts something that's misinformation, I can't just let it stay there. So sometimes if you want to comment once to correct the misinformation, so that others may see that, I think that's fine. But other than that, don't engage, don't get into conversations. So just another social media rule. That's really important one, actually.
Yeah, I see a question regarding how do you speak to people about the idea of big pharma just there to make money? They don't want people to be healthy. They just want them to be sick. So the immunizations actually are doing that. And there's a point where you have to gauge the conversation you're having. And as Alex said, our most precious asset is time. And I'll never forget the room I went into, and I said, hey, today Sally's due for her TDAP or HPV and her meningitis. And the dad's like, you get your daughter that HPV vaccine? I said, yeah, I did. And he went, then you should go to jail. And I'm like, okay, so we'll just do the TDAP and meninge and the exam looks correct. So, I mean, I did a quick calculation of thanks for bringing her in for the visit, just secure, went right to S. I'll use that time elsewhere.
That's hilarious. The next question on the list actually talked about some politics, and a lot of this stuff it's becoming increasingly more tribal, and people will vaccinate or not vaccinate because that's what their team does. And I'm curious. So this question was addressing basically politicians who are introducing, anti-vaccine bills, but I would even pivot more towards how do you convey these vaccine messages, especially on social media, and still be nonpartisan and try to be above that fray, because that seems to be where the fighting is right now.
I will tell you, if you're okay, Alex, I'm going to jump in quick, is that for the longest time, I did my best to not be partisan in my social media postings. My communications director, even though it was my account, was coaching me through that. But I'll tell you what, when partisan politics takes a firm stand on health and science, you almost have to address it in some capacity. Peter Hotez at the AAP's national conference this year put a slide up on COVID deaths comparing Republicans and non-Republicans, and it was a public health reality. I mean, if you use demographics, age, sex, whatever, this was a demographic that showed a huge disparity in death, right? To not talk to it, I think is a mistake. Now, I don't think you come jumping out at somebody and blah blah blah, and I'm a tree hugging liberal, and maybe I am, but the point is, I think it's fair enough to say I grew up in a time up until about 2016 where science was kind of, yes, you could say climate and everything, but health in general was pretty much bipartisan. Kids were usually pretty bipartisan, and everybody kind of got behind, I don't know the science. Like, you guys went to medical school. I purposely didn't go to medical school and take second biology or physics or chem because I don't like that crap. And now it's funny where everybody's like, oh yeah, I could talk to you about mitosis, and I can talk to you about assays because I just saw this YouTube video. It's like, no. Like, they don't know health, right? This is now basically, there aren't alternative facts to science. Science can be rewritten when you find science that refutes it. But in this case, this isn't better science. This is just political positioning. And this is not a place for politics. And as a result, there's clear data on people getting hurt. That may not resonate with everybody. I understand that might turn some people off, but you got to nuance your message perhaps a little to the audience, but I don't shy away from that. And if somebody's like, forget you, I don't even want to hear it, then I don't know. I mean, I try, and I'm a pretty nice guy. I can usually engage with most people, but I think we need to call it out to a degree.
Yeah. I don't really engage a whole lot with politics, even though I live in California. The area where I practice is purplish, deep purple, light purple, I don't know, whatever, slightly more Republican than Democrat. So I really don't, I just focus on the patient. I focus on health. I focus on what's best for them and their family, really. I always try to frame either my in-person conversations or my social media posts about what's best for the patient, what's best for the community, what's best for physicians to help take care of their communities and take care of their patients. I really try to stay out of politics, honestly. It doesn't feel good. But that's just my opinion. It's highly individualized, I think. But I do agree, like Peter Hotez putting up that slide at AAP. I wish I'd been there, actually. If when it comes to demographics and there's a clear difference, then that is data, I think, that we can use to help educate ourselves and educate our patients as well too. But personally, it just doesn't feel the right message for me.
Yeah, and I'll do that in larger formats. I don't usually ever do that on a one-on-one and in the office. And I will say your trusted healthcare relationship usually supersedes all that, because you're just there to take care of their kid or them. And you've never talked about politics before. And I think exactly what Alex is telling you on a one-to-one and with families, you're just there to do what you can to help their family. I will say, when I've been giving talks over this last 2 and 3 years, sadly, I'll ask for a show of hands, like, have you felt personally attacked in the last 2 or 3 years? Because that's part of the strategy right now. Attack healthcare providers, attack teachers, attack educators, attack nurses, attack public health officials or professionals, right? It's a weird time we're living in because we're purposely being put in the line of fire and in the target.
But if because of that we stop speaking up, they win, which is why we can't stop speaking up, which is why we can't let that attack dissuade us. We need to double down on our efforts message and keep fighting and keep getting others to stand up and to fight what's right and what's accurate, scientific, evidence-based information. Okay, rant over. Well, this rant, I'm sure I have another rant soon.
No, we'll probably be continuing on. I do want to pivot a little bit from maybe the conversation that's focused, with politics at this sort of 30,000 foot level to the concrete reality of government institution like the CDC. And there have been we had questions before. We have questions in the Q&A now. And so maybe to toggle in on that a little bit more, do you feel that the communication that happened from the government and health agencies increased confusion and fed hesitancy, or in your own practice, did messaging from public health bodies or authorities that were setting the tone that then clinicians and providers were to execute on? How do you feel those communications went over? And you can, and you can talk about it as a spectrum too over time if you felt they improved or got worsened.
Poorly. Go ahead, Alex.
I have to say, let me jump in first here. This reminds me of the quote from Men in Black. I think it was Men in Black 1, when Will Smith asked Tommy Lee Jones, well, how come you don't just explain to people that they're aliens living on Earth and we're coexisting happily and no one knows this? And Tommy Lee Jones responded was, individually, people make sense and you can talk to them and you can educate them. Collectively, people are stupid, or something along those lines, right? And I think I'm going to include myself in that collective as well too. So I don't want that job at the CDC for all the social media followers in the world, right? That was an extremely challenging position to be put in, and I'm not going to sort of sit here and play Monday morning quarterback. I think they were given an impossible task to really educate millions and millions of people with a single message, which is not going to resonate with anyone as a result. And so it was sort of a no-win situation, I think, in many respects, which is why healthcare is complicated, which is why you have an individual physician and not one physician for the entire country telling people what to do, because everything is so individualized to that person. You have to take information and apply it to that individual patient. That's what we're trained to do as physicians as well too. And messaging works very much similarly. You can have general themes, but you have to take those themes and apply it to the individual patient as well too. So, were mistakes made? Yes. Do they try to oversimplify things? Yes. Could I have done a better job? Absolutely not. That's just my own 2 cents too. It's challenging.
I'll agree with that, right? It's not an easy job. I will say, don't forget that the really health agencies were purposely being undermined under the previous administration, which was played right into the hands of creating chaos. There are certain things they did that could have been done better. Paul Offit in the AAP National Conference put the word up breakthrough. He said it was an absolute debacle that word was ever used, which was just fodder for breakthrough means it's not working. Look at, right. So I remember him putting that, I copied that slide. So there are things that could have been done better, but it is close to an impossible job. And now, given the politicization of healthcare and health and everything else, it's become even a more impossible job. So I will say, we go back to that trust relationship. Somebody put up a question about Florida. I don't even know what the hell you do with that. Like, you have a governor who's actively pushing disinformation and appoints as his Surgeon General somebody from the American Frontline Doctors, the same organization that brings you demon sperm and alien technology. It just basically says you can't, right? The whole idea here is you can't believe anything. So come to us and we'll tell you what to believe. That's exactly the playbook that they're in right now. Like, we don't even have an issue. We're just telling you be mad at everybody and don't believe anybody, and we'll tell you what to do and when to vote. That's what one of the parties is doing.
And I think that's the challenge here, right? For to sow enough distrust not to do anything is a win for them, versus us. We have to give you enough information you actively do something. It's a much higher bar. It's a much harder challenge. I think no matter what messaging we use, sort of collectively, the anti-vaxxers are going to find a way to combat it, right? It's literally an impossible situation.
Except we need more of us to kind of form together and support one another, because there's way more of us than them. So
do you need a hug, Todd? I'll give you a hug.
I want a hug.
Computer.
I want to
give you a hug.
Digital hug. Digital hug.
I love that call to action. Well, I'm excited when COVID-26 comes around that Todd will be the CDC director and Alex will be the FDA director, and we'll all be in better shape. So, but thank you guys so much for joining us yet again. This was an amazing hour. We probably could have talked for another 6 hours. I just want to let everyone know that the previous conversation that we had last month is on the California Immunization Coalition webpage. I put the link in the chat. And then also we did 15 COVID conversations similar to this with experts, including Todd and Alex were, I think, our second or third guests back in early 2021. So you can view all of those on the California Immunization Coalition website as well. For some housekeeping, you guys will receive an evaluation at the end of this webinar. It just takes a few minutes, always helpful for us to figure out what we're going to do moving forward with webinars. So if you can fill that out, that would be fantastic. Next. And then we will post these slides to our California Immunization Coalition website. And then all of our recordings, including this one, are on our website. And we also have a YouTube page, which you can view. And again, last thing. This is really important. California Immunization Coalition every year has a summit, which is an incredible place to meet like-minded healthcare professionals, people interested in immunization. A lot of people work with their county immunization coalitions. This year, it is May 8th to May 9th in lovely Riverside, California. We'll have great speakers. It is in person this year for the first time in a while. So please register on our website or using that QR code there. We hope to see you there. It's always a fantastic event. And with that, we wanted to thank everyone for joining us. Thanks to Todd and Alex and Margaux for everything. And go out there and keep doing good work, everyone. Thanks so much.
Thanks, everybody.
Bye, guys.